This is an instructional slideshow on advanced care planning for young adults using the Voicing My Choices document in a simulated setting. As an introduction, I will give background, discuss the problem, the purpose, do a literature review, talk about the Voicing My Choices document, then about the simulation in specific, and summarize. A young adult with a life-limiting condition is faced with the contradictory issues of being forced to look at the end of their life in the midst of their own developmental challenges. The tasks during young adulthood include trying out decision-making and working towards establishing one's identity and autonomy. Social support or communication with family, friends, healthcare providers, and other patients is a primary coping strategy for this population and is associated with positive outcomes. So, not respecting the decision-making ability of young adults leads to poor communication and increases distress in both the patient and the family. The essence of advanced care planning is communication. It's communication about future health care, including the end of life, and it can improve quality of life, autonomy, and self-determination. So the problem is that a diagnosis of a life-limiting condition is a threat to one's autonomy and self-control. Advanced care planning preserves patient autonomy and enables a sense of self-determination and self-control even at the end of life. However, adolescents and young adults are rarely offered the opportunity to participate in advanced care planning. So the purpose of this project is to use an advanced directive document as a guide to initiate communication about advanced care planning for young adults with life-limiting conditions. It is hoped that this will be viewed positively by the clinician and the patient, and that it will facilitate further communication about end-of-life issues in other settings among the patient, the family, and the healthcare team. In the literature, the process of advanced care planning is shown to improve quality of life at the end of life by increasing communication, social support, autonomy, and emotional well-being, and decreasing stress, anxiety, and depression. However, approaching these topics is challenging, and there is often discomfort on the part of the clinician as well as the patient and the family. Issues such as fear of removing hope, lack of training, and timing are described as barriers to discussions about end of life. These conversations are not easy, and they're often avoided by both healthcare providers and families. They're even less likely to occur if the patient is not an adult. The literature on pediatric advanced care planning has increased in recent years and shows that this communication does not result in distress or negative effects on psychological well-being, and it's actually helpful to patients and caregivers. The recent Institute of Medicine report on dying in America recommends that advanced care planning communication occurs throughout the lifespan for all individuals, including children capable of participating, and that it is the clinician's responsibility to initiate these conversations. There is emerging evidence describing the benefits of using structured advanced care planning programs for young adults and for the completion of advanced directive documents. However, the strategies available to guide communication with young adults remain limited. Though there are few structured programs for pediatric advanced care planning, the ones that exist are successful and are perceived as helpful to patients and caregivers. One such strategy is the FACE method, and that stands for Family Adolescent Centered Advanced Care Planning, and it's a model that is used in several randomized control trials by Lyon et al. And Garvey et al. The model involves 3 sessions that are 60 to 90 minutes long with the adolescent and their surrogate. The sessions involve first the Lyon Advanced Care Planning Survey, second, the Respecting Choices Advanced Care Planning Interview, and that measures congruence of treatment preferences in a variety of scenarios. And third, the completion of an advanced directive document called the 5 Wishes. This method has been found to be beneficial, but it is time and resource intensive. However, it has been shown that using the advance directive as a guide may circumvent some of the barriers to initiating end-of-life conversations. Many other qualitative descriptive studies have been useful in content analysis of advance directives and advanced care planning programs for use in pediatric populations. These offer insight regarding patient perspectives, concerns, and preferences. The only advanced care planning document specifically designed for young adults and adolescents is the Voicing My Choices. This was developed and reported in the Wiener et al. And Zadeh et al. References. Voicing My Choices can be found on the Aging with Dignity website. The web link is here. The document is copyright protected and is available in this simulation with permission. Voicing My Choices was developed based on the 5 Wishes, which is a legal advance directive document for those over 18. Feedback from young adults enabled the 5 Wishes to be modified to include preferences not only for medical decision-making, but also for how young people wish to be remembered. The resulting Voicing My Choices document has established content validity and is presented in a format and appearance that is preferable to young adults and adolescents. Although it is not legally binding, it has been recognized as helpful in initiating end-of-life discussions and in describing the wishes young adults have surrounding their decisions and their preferences. If you haven't already pulled up the website for Voicing My Choices or referenced it in the handout, please do so now so we can overview the document. The Voicing My Choices is a booklet that has 16 pages, including the cover. The second page is a signature page that includes a space for a witness. Page 3 is an introduction to and explanation of the contents of the booklet. This description includes how the booklet was developed, that the topics may be difficult, that the booklet can be completed in as much or as little as desired, and that there are no right or wrong answers. The introduction also encourages the participant to use the glossary that is provided on page 15, as well as to discuss questions with their healthcare provider. The content sections include how I want to be comforted, how I would like to be supported, who I want to make my medical care decisions, the types of life support treatment I want or do not want, what I would like my family and friends to know, my spiritual thoughts and wishes, how I wish to be remembered, how I would like to share my belongings, and my voice, which is a blank section for a personal message. Each section has both structured items and checkboxes labeled My Choice, as well as open-ended sections labeled My Voice. In this simulation, you will use the Voicing My Choices to structure an advanced care planning conversation with a young adult. The young adult will be a standardized patient. The Advanced Care Planning Simulation case study is provided also in the handout, but I will discuss it here as well. Taylor is a 16-year-old patient with diffuse intrinsic pontine glioma, an aggressive brain cancer. Primary treatment for DIPG is 6 weeks of radiotherapy and steroids. The majority of patients show improvement of symptoms following radiation therapy and have a period of relative stability. However, the median time to progression is 5 to 8 months following initial treatment, and then the disease progresses quickly. The median survival from time of progression to death is 1 to 4 months. The role of chemotherapy is limited, and patients may be eligible for clinical trials. Fewer than 10% of children with DIPG survive 2 years from diagnosis. Taylor completed radiation and has been stable for 6 months on a clinical trial. She has recently had worsening double vision and equilibrium. Taylor is a good student and is active in her school. She played soccer prior to her diagnosis, and she has a lot of really close friends. She has not been able to go to school much due to her vision changes and lack of energy, but her friends keep in touch with her and come to see her. The family is supportive but stressed. They understand the diagnosis and prognosis, but they are grieving and having a difficult time communicating with their daughter about the course of her disease. The patient is quiet but responsive and more engaging as the simulation goes on. She recognizes that she is not getting better, but she also knows her family is not comfortable talking about this. Therefore, she has not had an opportunity to talk to anyone about the possibility that she might not get better or may even die. In this simulation, you will not be discussing prognosis, but you will discuss the topic of advanced care planning by using the Voicing My Choices document. There are several ways to introduce the Voicing My Choices document. There's an introduction printed on page 3 of the document. Alternatively, there's a suggested script in the ZDAE article. Their suggested introduction is as follows. Although we are hoping that this next treatment will be helpful, many people your age have told us that they have found it helpful to have a say about what they would or would not want if treatment doesn't go as expected. In fact, people your age have helped us create a guide so that they could put down on paper the things that are important to them. Once the topic and the booklet are introduced, it is nice to have the patient sign the booklet on page 2 to make it theirs. You do not have to sign it as a witness at this point, as the document will only be started. You may suggest that you will come back later to do this if they want more time. You will give an overview of the booklet by describing each section. You can do this by using the descriptions at the top of each page or by using the script provided in the ZDAE et al. Article. Once you have reviewed the document, offer the patient an opportunity to pick a section to complete. Allow the opportunity for the patient to comment and complete whatever he or she wishes. Let them know that it is okay not to complete the whole section. Allow the patient to ask questions and look for opportunities to open the discussion. Once the section is complete, discuss this with the patient and allow them the opportunity to tell you about what they wrote. Ask them if they need to change anything, encourage them to ask questions, and to open this discussion or share the booklet with whomever they feel comfortable, whether it's family, friends, or other healthcare team members. The document should be left with the participant. It's theirs. The intent of this exercise is to open the communication among the patient, the family, and the healthcare team, and that the document would be continued to be worked on. Summarize and plan your follow-up before you leave. Remind them that you will be back to check and see if they want to talk more about this. There will be a questionnaire for you to complete as the clinician once you leave the patient room. In summary, for this simulation project, I want to leave you with this. Advanced care planning is an important and too frequently missing step in the care of young adults with life-limiting conditions. There is evidence to support the recommendation that clinicians routinely provide advanced care planning to young adults. It is hoped that the use of an advanced directive document as a guide to initiate communication about advanced care planning for young adults will be viewed positively and will facilitate further communication. Clinicians should routinely provide advanced care planning to young adults with life-limiting conditions. Ultimately, advanced care planning should become part of every patient encounter, no matter the patient age or disease state. These are the references, and I thank you so much for participating.